Hi and welcome viewers of Nursing Academy 101. In this video we will talk about the latest and updated Prometric questions for nurses along with the answers and rationales part 1. But before we start, please, do not forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question 1. A client is admitted with a suspected myocardial infarction. Which laboratory value should the nurse prioritize monitoring to assess cardiac damage? A. Serum creatinine levels. B. Serum potassium levels. C. Troponin levels. D. Hemoglobin A1C. Answer: C. Troponin levels. Rationale: troponin levels are specific markers for cardiac damage and are elevated in myocardial infarction. They help diagnose and assess the severity of heart injury. Serum creatinine levels assess kidney function, serum potassium levels monitor electrolyte balance, and hemoglobin A1C reflects long-term blood glucose control. Question 2. A client with a history of deep vein thrombosis, DVT, is prescribed enoxaparin, Lovenox, a low molecular weight heparin. The nurse should monitor the client for which potential adverse effect? A. Hyperkalemia. B. Hypotension. C. Hematuria. D. Bleeding. Answer: D. Bleeding. Rationale: enoxaparin is an anticoagulant that can increase the risk of bleeding. Clients receiving anticoagulant therapy should be closely monitored for signs of bleeding, such as petechiae, ecchymosis, and blood in the urine or stools. Hyperkalemia, hypotension, and hematuria are not direct effects of enoxaparin. Question 3. A client is prescribed warfarin, Coumadin, therapy. The nurse instructs the client to avoid which type of food while taking warfarin? A. Leafy greens. B. Lean protein. C. Whole grains. D. Citrus fruits. Answer: A. Leafy greens. Rationale: clients taking warfarin should avoid or consume consistent amounts of foods high in vitamin K, such as leafy greens, example, spinach, kale, as vitamin K can interfere with the anticoagulant effect of warfarin. Lean protein, whole grains, and citrus fruits do not significantly affect warfarin therapy. Question 4. A client with diabetes is prescribed insulin glargine, Lantus, a long-acting insulin. The nurse explains to the client that insulin glargine A. should be mixed with short-acting insulin before administration. B. has a rapid onset of action. C. provides a peak effect in the early afternoon. D. provides a steady and consistent basal insulin level. Answer: D. provides a steady and consistent basal insulin level. Rationale: insulin glargine is a long-acting insulin that provides a steady and consistent basal insulin level over a 24-hour period. It does not have a peak effect and is not mixed with short-acting insulin. Its onset of action is gradual, and it is often administered once daily. Question 5. A client is diagnosed with schizophrenia and is prescribed haloperidol, Haldol, a typical antipsychotic medication. The nurse should monitor the client for which potential adverse effect? A. Weight gain. B. Hypertension. C. Extrapyramidal symptoms. D. Sedation. Answer: C. Extrapyramidal symptoms. Rationale: haloperidol is a typical antipsychotic medication that can cause extrapyramidal symptoms, EPS, such as dystonia, akathisia, and Parkinsonism. EPS are movement disorders that can be uncomfortable or distressing for the client. Weight gain, hypertension, and sedation are potential adverse effects of other antipsychotic medications, particularly atypical ones. Question 6. A client is prescribed digoxin for heart failure. Which assessment finding would indicate a potential adverse effect of digoxin therapy? A. Bradycardia. B. Hypertension. C. Hyperkalemia. D. Tinnitus. Answer. D. Tinnitus. Rationale. Tinnitus, ringing in the ears, is a potential early sign of digoxin toxicity. Other symptoms may include nausea, vomiting, anorexia, and visual disturbances. Bradycardia is a therapeutic effect of digoxin, while hypertension and hyperkalemia are not associated with digoxin toxicity. Question 7. A client is diagnosed with disseminated intravascular coagulation, DIC. Which laboratory result would the nurse anticipate in this client? A. Elevated platelet count. B. Prolonged prothrombin time, PT. C. Decreased fibrinogen levels. D. Normal D-dimer levels. Answer. C. Decreased fibrinogen levels. Rationale. Disseminated intravascular coagulation, DIC, is characterized by widespread clotting and bleeding. It leads to the consumption of clotting factors, including fibrinogen, resulting in decreased fibrinogen levels. Prolonged PT and elevated D-dimer levels are also indicative of DIC. Question 8. A client with a history of peptic ulcer disease is prescribed ranitidine, Zantac, a histamine H2 receptor antagonist. The nurse explains that ranitidine works by A. Neutralizing gastric acid. B. Inhibiting gastric acid secretion. C. Promoting gastric emptying. D. Coating the stomach lining. Answer. B. Inhibiting gastric acid secretion. Rationale. Ranitidine is a histamine H2 receptor antagonist that works by inhibiting gastric acid secretion. It reduces the production of stomach acid by blocking histamine receptors on the gastric parietal cells. Neutralizing gastric acid, promoting gastric emptying, and coating the stomach lining are not mechanisms of action for ranitidine. Question 9. A client is admitted with acute pancreatitis. Which dietary intervention should the nurse recommend for this client? A. Low-fat diet. B. High-protein diet. C. High-carbohydrate diet. D. High-fiber diet. Answer. A. Low-fat diet. Rationale. A low-fat diet is recommended for clients with acute pancreatitis to reduce stimulation of the pancreas and minimize exacerbation of inflammation. High-protein, high-carbohydrate, and high-fiber diets can increase pancreatic enzyme secretion and worsen symptoms. Question 10. A client is prescribed furosemide, Lasix, a loop diuretic. The nurse should monitor the client's serum potassium levels due to the potential for A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. Answer. B. Hypokalemia. Rationale. Furosemide is a loop diuretic that increases potassium excretion in the urine, leading to the risk of hypokalemia, low potassium levels. Monitoring serum potassium levels is essential to prevent complications such as cardiac dysrhythmias and muscle weakness. Hyperkalemia, hypernatremia, and hyponatremia are not the primary risks associated with furosemide. Question 11. A client is admitted with suspected meningitis. The nurse assesses the client's neck for signs of meningeal irritation by performing which test? A. Kernig's sign. B. Hohmann's sign. C. Babinski reflex. D. Trousseau's sign. Answer. A. Kernig's sign. Rationale. Kernig's sign is a clinical test used to assess meningeal irritation. The nurse flexes the client's hip and knee at 90-degree angles while the client is lying supine, and then attempts to extend the knee. Resistance or pain during knee extension is considered a positive Koenig sign and may indicate meningeal inflammation. Question 12. A client is prescribed isoniazid, INH, for the treatment of tuberculosis. The nurse should educate the client to avoid which type of food while taking isoniazid, a. Dairy products. B. Foods rich in vitamin K. C. Foods high in tyramine. D. Foods containing histamine. Answer. C. Foods high in tyramine. Rationale. Isoniazid, INH, can interact with foods high in tyramine, such as aged cheeses, cured meats, and certain fermented foods. This interaction can lead to hypertensive crisis. Clients taking INH should be educated to avoid these foods to prevent adverse effects. Question 13. A client with heart failure is prescribed spironolactone, aldactone, a potassium-sparing diuretic. The nurse should monitor the client's serum potassium levels due to the potential for A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. Answer. A. Hyperkalemia. Rationale. Spironolactone is a potassium-sparing diuretic that can lead to hyperkalemia, high potassium levels, due to its mechanism of action that reduces potassium excretion. Monitoring serum potassium levels is essential to prevent complications such as cardiac dysrhythmias. Hypokalemia. Hypernatremia and hyponatremia are not the primary risks associated with spironolactone. Question 14. A client is diagnosed with ulcerative colitis and is prescribed mesalamine, Asacol, an anti-inflammatory medication. The nurse instructs the client to take the medication. A. With meals. B. On an empty stomach. C. At bedtime. D. With a full glass of milk. Answer. A. With meals. Rationale. Mesalamine is often prescribed to be taken with meals to minimize gastrointestinal upset. Taking the medication with food can help reduce potential side effects and enhance its therapeutic effect. Question 15. A client is admitted with suspected acute glomerulonephritis. Which assessment finding would the nurse anticipate in this client? A. Increased urine output. B. Hypertension. C. Hypoglycemia. D. Hypocalcemia. Answer. B. Hypertension. Rationale. Acute glomerulonephritis can lead to decreased renal function and impaired filtration, resulting in fluid retention and hypertension. Increased urine output, hypoglycemia, and hypocalcemia are not typically associated with acute glomerulonephritis. Question 16. A client is prescribed atenolol, a beta blocker. The nurse should educate the client about the potential side effects of this medication. Which side effect should the nurse include in the client's education? A. Diarrhea. B. Bradycardia. C. Hyperglycemia. D. Urinary retention. Answer. B. Bradycardia. Rationale. Atenolol is a beta blocker that can slow down the heart rate, leading to bradycardia. Clients taking atenolol should be educated about potential adverse effects, including bradycardia, hypotension, and dizziness. Diarrhea, hyperglycemia, and urinary retention are not typical side effects of beta blockers. Question 17. A client with diabetes is prescribed metformin. The nurse instructs the client to avoid excessive alcohol consumption while taking this medication due to the increased risk of A. Hypoglycemia. B. Hyperglycemia. C. Lactic acidosis. D. Diabetic ketoacidosis. Answer. C. Lactic acidosis. Rationale. Metformin can increase the risk of lactic acidosis, especially when combined with excessive alcohol consumption. Lactic acidosis is a serious condition that can be life-threatening. Clients taking metformin should be educated about the importance of moderating alcohol intake to reduce this risk. Question 18. A client is admitted with a suspected peptic ulcer. Which diagnostic test can confirm the presence of Helicobacter pylori, a common cause of peptic ulcers? A. Electrocardiogram, ECG. B. Upper gastrointestinal, GI, endoscopy. C. Complete blood count, CBC. D. Stool antigen test. Answer. D. Stool antigen test. Rationale. The stool antigen test is a non-invasive test used to detect the presence of Helicobacter pylori in the gastrointestinal tract. Upper G endoscopy may reveal the ulcer but does not directly confirm the presence of H. pylori. An ECG and CBC are not relevant to the diagnosis of peptic ulcers. Question 19. A client is diagnosed with Guillain-Barré syndrome. Which intervention is a priority in the care of this client? A. Administering high-dose corticosteroids. B. Initiating plasma exchange therapy. C. Encouraging active range of motion exercises. D. Providing aggressive pain management. Answer. B. Initiating plasma exchange therapy. Rationale. Plasma exchange therapy, plasmapheresis, is a priority intervention in Guillain-Barré syndrome. It involves removing and replacing the client's plasma to remove harmful antibodies and inflammatory mediators. This treatment can help improve symptoms and prevent further progression of the disorder. Question 20. A client with chronic obstructive pulmonary disease, COPD, is prescribed ipratropium bromide, Atrovent, an anticholinergic bronchodilator. The nurse instructs the client about how to properly use the inhaler. Which instruction should the nurse include? A. Inhale deeply and rapidly. B. Exhale fully before inhaling. C. Shake the inhaler vigorously before use. D. Press the canister multiple times before inhaling. Answer. B. Exhale fully before inhaling. Rationale. When using an inhaler, clients should exhale fully before inhaling the medication. This ensures that the medication is delivered deep into the lungs. Inhaling rapidly or pressing the canister multiple times is not recommended and may lead to ineffective drug delivery. Shaking the inhaler vigorously is not necessary for ipratropium bromide inhalers.